we'll take in an expert word. We have Dr. Sanjeev Bagai with us, but before that, let me quickly go across to my colleague Pratibha. The Health Ministry says India is prepared, Pratibha, for any kind of public health exigency. If you could take us through the detailed statement, please.
Absolutely. In fact, Kritsween, there have been a lot of concerns over the reports that are emerging from China, and in this update, people in India should rest assured that there's not much to worry about. That's the update that has come in, with the Union Health Ministry saying that it is closely monitoring the reported outbreak of H9N2 cases and clusters of respiratory illness in children in northern China. There is low risk to India from both avian influenza case reported from China as well as the clusters of respiratory illness, and they've mentioned a few reports that have come in and the concerns regarding the same, and said that a meeting was recently held under the chairmanship of the GHS to discuss the preparedness measures against human cases of avian influenza in the country, saying India is prepared for any kind of public health exigency. India is embarking on a One Health approach to adopt a holistic and integrated roadmap towards addressing such public health issues. There has been a significant strengthening of health infrastructure, especially since the COVID pandemic, and saying that the infrastructure has been boosted up after the COVID pandemic, so there's not much to worry about. India is absolutely prepared, but as of now, there's no threat in the country.
Many thanks for that, Pratibha and Akanksha. Dr. Sanjeev Bagai, like Pratibha just pointed out and highlighted from the statement that's coming from the Ministry of Health, yes, there has been significant strengthening of health infrastructure in India, especially since COVID-19. That's what the Health Ministry has pointed out very clearly. But are you worried about these signs we're picking up from China?
Good evening. I think what is well established globally now is that China are serial offenders. Whatever they say has practically zero credibility. We know that it's a localized epidemic at the present moment. There is a transmission of respiratory infections, but at the present moment, they've not come out clean to document whether it's what we call as H1N1, the common flu, or whether it is the avian flu, or indeed it is the adenovirus infection, respiratory infection, RSV, which is the respiratory syncytial virus infection, or mycoplasma pneumonia. So there are different versions which are being coming out from the China sources, so to say. We know that there is a child-to-child transmission. Children, especially with asymptomatic infections, even in Omicron, have had a vast devastating effect as far as the immunity is concerned, and there is an increased risk post-COVID of respiratory infections. And also China's zero COVID policy has not allowed community-acquired immunity to develop within their own countrymen. Having said that, I think India is at the present moment in a safer zone. Indian vaccines have worked very well for COVID. Influenza is a well-established vaccine which is given to Indian children and indeed teenagers and adults. We need a high index of surveillance. We need to keep our watch. But an important point here is that WHO needs to get its act together. They did not serve us well globally during the COVID because it failed to document an early rise of infection, and neither we still know the source. So we need to be more proactive as far as WHO is concerned, and China needs to do a lot of answering at the present moment going forward.
Okay, very interesting that you mentioned WHO, because the Health Ministry in the statement also said that overall risk assessment by WHO indicates a low probability of human-to-human spread and low case fatality rate among human cases of H9N2 reported to WHO so far. That's what the Ministry of Health statement says. But like you said, we need to watch out for the signs. We need to not buy everything at face value, especially when it comes to China. Also, what really explains this? 7,000 children being admitted on an average to one single hospital in China. So there has to be some sort of, transfer or, so to say, communicable diseases aspect that needs to be looked at here.
Yeah, so I would, being in pediatrics for close to 40 years, I would rather advise WHO to be careful with what they advise and be sensitive in what they advise going forward. All the infections which I have mentioned, be it the influenza, be it the adeno, be it the RSV or mycoplasma, have airborne transmission. There is human-to-human transmission. Children are more likely to catch it because there is household transmission too, plus in schools and in close clusters, crowded places where children are playing. So there is a mode of transmission that's well documented. The R0 of these viruses are also pretty high. So we need to be careful. We can't put our guard down. I think early signs need to be picked up in case any child or teenager, mainly under 5 years of age, have any cough, hacking cough, breathlessness, feeding difficulty, vomiting, or lethargy, I think they need urgent medical attention. Advises not to panic, don't self-medicate, but seek medical attention when these warning signs are flagged.
Just like was advised in the initial stages of COVID-19, not just here in India, across the world. We have Dr. Ashish Jaiswal, a pulmonologist, with us as well on the broadcast. Thank you, doctor, for speaking to us. Now, this mysterious pneumonia outbreak that swept through schools, it's resulted in hospitals being overwhelmed with sick children in China. How do you look into this, especially given, respiratory illnesses are concerning in India as well, given the current situation in Delhi NCR, for example? We've been tracking what's happening with regards to the air pollution, so on and so forth. How do we see the two together?
Yes, definitely. If we talk about India and in this scenario where AQI is so much high, and there's a lot of chances of an increased respiratory infections in India also. So it's a point to be in favor of what sir told earlier, that we have not to be panic in this situation because we have no robust system. But important point is that we should take care early in the clinical situations. Suppose if your children got sick and some got some infection, try not to self-medicate and reach hospital as early and meet your pediatrician and do what is all required now. You know what happened in India right now? This is the surge of respiratory infections in India too, because in this season we have a lot of respiratory infection as well as this deteriorating air condition and also add into it. But again, at present we have not much to panic about these conditions, and I think it is just like a different similar infections which is spreading in India, which is causing all those things. But again, what's most important thing is about the vaccination. So every parent should be, very well versed with vaccination, and if not, then definitely do vaccination to the children. That is always a boom for our children.
Okay, watch out for the signs, seek medical expertise. This most certainly has caused concern among global health experts. Our experts here are on the panel. We've opened our call-in lines as well. Dr. Sanjeev Bagai, if you could quickly address the concerns as are going to be pointed out by Jayanti, who's calling us from Madurai. Good afternoon, Jayanti.
Hello, madam. So I am watching your channel, and I have two doubts. And we are elderly couple, and we already taken our COVID vaccination already and booster also. So is there any problem for us regarding this mysterious pneumonia? Number one. Number two, my husband he is having a COPD. So what kind of guidelines we should have to follow?
Dr. Sanjeev Bagai?
Two quick points in this. What is very clear so far, at least at the present moment, we shouldn't say anything too early from China, because the cause and etiology of this pneumonia is yet to be documented. I don't think that it's COVID pneumonia. And as far as India is concerned, we've almost covered 95 to 98% of the adult and the eligible teenage population pretty well, even with 3 doses. So I don't think COVID is an issue. But I think in India, we need to be careful with regards the common influenza virus. RSV is very common, adenovector is very common, and some other communicable respiratory viruses. And indeed, bacterial infections are also transmissible. But with regards your husband having COPD, we know that any comorbid condition like COPD or asthma or any pre-existing respiratory illness can predispose a person 3 to 5 folds more towards ongoing infection. So you need to be careful. Please wear a mask when you're going out. Also in northern India in winter, we know that the pollution increases the risk of infection and long-term scarring of the lung tissue in case there is infection. So we need to be careful, wear a mask when you go out, and be careful for early warning signs.
Jayanti, I hope that addresses your concerns. Many thanks for joining us this afternoon. Also thanking Dr. Sanjeev Bagai and Dr. Ashish Jaiswal. We're going to track this very closely. Remember, like our experts pointed out, more details and information perhaps is needed from China on what may have led to this kind of a triggering situation. Thank you for joining us, doctors. With that, we head into a very quick break. More lined up on the other side.